Alexis looked into that, joins us now with a look at the vaccine allocation numbers state by state. Alexis, this supply-demand question, is that going to be an issue?
Yes, I don't think you can even try to produce the vaccine as quickly as the demand is really there. However, people are doing what they can in the state to try and get as many vaccines out as possible. However, as the state starts to receive more vaccine, it doesn't necessarily mean the state will receive a much greater amount of vaccines than what they've been receiving. Now, I took a look at the current doses allocated for distribution this week. This is a general indicator for hospitals as they continue to pre-register people online. The chart that is right behind me is broken down into the Pfizer and Moderna vaccine. So looking at the Pfizer count, we have 29,250 that were administered in Louisiana for this week. We have for Oklahoma, 24,375. For Texas, 165,000. And then for Arkansas, we have nearly 18,600 doses that were administered this week. Now taking a look at the Moderna count, we look at Louisiana with 41,600 cases this week, doses this week. Oklahoma with 34,700. 241,000 for Texas, and Arkansas with 26,800 cases in doses. I spoke with infectious disease specialist Dr. John Vancheri, who explains that vaccine allocation is dependent on state population.
We're on target now to receive throughout our entire partnership a little more than 3,000 doses next week. Sort of taking the whole United States, 330 million people, and say in Louisiana we have about 4.5 million people, and so based on that population we're going to get about 1% or 1.5% of the available vaccine, and that translates into about 60,000 doses per week.
The states then further break down the vaccines based on each of the regions. Keep in mind, all second doses are already reserved despite the limited supply of the first dose. Carl?
Starting Monday, Louisiana will enter into a new phase of COVID-19 vaccine distribution. That's great news for people aged 65 and older. It opens the door for them to get the vaccine. The current phase restricted eligibility to those who are 70 and older and to first responders. Alexis Thrower joins us now with more on how LSU Health Shreveport is allocating doses. Alexis?
Yes, there's been some concern about people arriving at LSU Health Shreveport's drive-thru at the fairgrounds without an appointment. If you meet the criteria, you've been allowed to get vaccinated regardless. The question comes up about how LSU Health is accounting for the people who don't pre-register, given the limited vaccine supply. The hospital has consistently stated that they welcome those who may not have internet access, don't have an email address, or were simply unable to register before arriving. You will not be turned away if you meet the criteria and didn't pre-register. Registration is still encouraged if possible, though. This helps better gauge and control the flow of traffic when the hospital issues appointment slots at the fairgrounds.
I just decided to show up.
And did you register before you came here?
No, ma'am, I didn't.
So we're in a good situation in terms of our vaccine supply right now is quite good, but I'm being very cautious not to schedule more people than we can handle, because the last thing I want to do is have somebody show up and us not have vaccine for them.
Dr. Vancheri says access to the vaccine is much more important than whether or not you have an appointment. The hospital is essentially padding the dosage to account for unregistered participants. Keep in mind, if you already received a first dose and are waiting for a second dose, your dosage is still available. Second doses are already reserved despite the limited supply for the first dose. Linnea?
Everybody lining up to get that shot. All right, thanks, Alexis.
Starting Monday, Louisiana hits a new phase of vaccine distribution. Now those aged 65 and up can get their shots. And as these efforts expand, LSU Health Shreveport is bringing in second-year medical students to get some hands-on experience at the drive-through clinic. Our Alexis Thrower was at the fairgrounds today, and she talked with some of those students. Alexis, maybe they're excited to be part of history here?
They were excited, but when they enrolled in medical school, they probably didn't account for a pandemic. However, they are taking advantage of the opportunity to better prepare themselves for the field. Under infectious disease specialist John Vancheri's supervision, second-year LSU Health Shreveport students learned to vaccinate. They talked about the learning curve that comes with learning in the midst of a pandemic. They also share what it's been like vaccinating at the Fairgrounds Clinic.
Type of school, the pandemic definitely, doesn't help, but I think it will make us into more efficient providers going forward, and definitely more dedicated providers. Your first 2 years of medical school, you're in the books a lot. You're you're in the library, you're not really dealing with patients too much. So this gives us real world experience.
Some pretty good patients, and then one even told me they didn't feel anything. So I think it was a pretty good experience.
See, they're awesome. The 3 medical students discussed the challenge of learning virtually, but they say it's a good experience though, because as medicine consistently makes technological advancements, they see that overlap in their education when they're practicing something like telemedicine.
True. More hands-on learning for them.
Right.
Alexis, thanks a lot.